Pain is good in the sense that it tells us that there is something wrong with that particular area. Weight-bearing joints have menisci, ligaments, so there could be injury to that joint if you're young. In the older age group, it's mostly because of the wear and tear of the cartilage or the cushion in between the joint, and it could be the pain because of the degenerative change. Talk to your primary care doctor about this. He or she would know right away whether this is something degenerative change, or is it something which is more acute on chronic, or it is an acute onset pain. If the pain has been ongoing for more than 4 to 6 weeks and has not resolved with the measures you've been undertaking, then I feel that you should see a doctor. Some inflammatory conditions, although which may be associated with infection, have to be addressed much more quicker. If you feel that the joint is associated with redness, swelling, and associated fever, then you should definitely get seen very quickly, because it could be a septic joint or it could be an underlying infection in the joint. We are able to resolve that quicker if a patient is started on antibiotics. Anything which goes beyond 6 months then gets classified as chronic. Under 3 months, I would still call it as an acute pain, and 3 to 6 months, I would call it as a subacute pain. All acute, subacute pain, if addressed appropriately in the very beginning, could prevent it from becoming a chronic pain. If he or she thinks appropriate, they could probably do an imaging study. They could also do a simple conservative treatment for 4 to 6 weeks, which would involve simply doing your routine exercises, limiting and restricting your activity, things like that. But if it has gone beyond that, then you should definitely see a specialist. Most times it could be orthopedics, or it could be a pain physician, depending upon whether you're having a joint pain or a spine pain. From there, you could be then further directed to various kinds of modalities, or if you need a surgical referral.